Hi, and welcome to the next of our socially distancing in the workplace seminars. Today we're going to be concentrating more on retail, leisure and hospitality. More so, if I'm being honest, on the retail sectors. They're the ones opening up first of all. So welcome to the next of the seminars, and I'd also like to welcome our guest today, Adam Young from Arco. He'll be taking you through some of the aspects that their company and he sees as the most important parts of things you need to consider when you're looking at reopening in your industry. And just a couple of bits of housekeeping I've got to go through to start off with. First of all, we will be taking questions throughout today's session. If you want to ask any questions, there's a question button you should be able to see on your dashboard. If you put them in there, we'll come to those at the end of each of our sessions. So we'll start off with Adam and he'll go through his, and then we'll do a question and answer session at the end of his session. And then I'll move on to talk a bit more about sort of risk assessments and individual things in terms of reopening there. And I'll take some questions at the end. I would like to point out this is funded by Grow Your SME through the Humber Growth Hub. If you'd like any further information about upcoming courses, upcoming workshops or support that's available, please do visit the Humber Growth Hub, which the details will be on your screen. So without further ado, I'll pass you on to Adam, who will take you through the first part of today's session.
Good morning, everybody. Thank you very much for the opportunity to talk to you today. My name is Adam Young. I'm the marketing director at Arco, and I'm going to tell you a bit about what we're doing at Arco to help industry get back to work. So returning to work safely. The things I'll cover off today, hopefully of use to you. I'll also share a link to some more content that I think is going to be provided with the presentation, so you'll be able to follow up on some of this if you'd like to. I'll assume that folk know who Arco are. It's the big shed on the A63. You see a picture of us there, coloured NHS blue. A couple of weeks back with our colleagues standing outside doing the clapping for the NHS. Not in normal times, we're suppliers of PPE, safety equipment, safety services to across industry. The last few weeks though has been a bit nuts, to say the least. We've changed what we've been doing a lot. And just to give you an example of that, on the right hand side of the screen here, you see this is a photo from China of us loading up a full 747 with face masks. We had 19 million face masks on that one plane that landed with us a couple of weeks ago. And so some of these numbers are staggering. We've got from May through to August, I think 140 million face masks going to be passing through the building you see on the left. So it's been really quite extraordinary times. So what I'm going to cover off today is just to talk about the process of returning to work safely, how you should go about managing that risk. Clearly, social distancing is going to be something that many businesses are going to have to put in place. So before you open, you're going to have to clean the workplace and probably put in some very different cleaning regimes than you might have had in the past. It's about PPE and the question everyone seems to want to ask about what kind of masks should people be wearing. Touch on hand hygiene, and I'll just finish off with just a note of warning about the risks of being caught out with some really dodgy stuff that's available on the market at the moment. So let me start off by talking about managing the risk. Now, as your people start to come back into the workplace, the thing you're going to need to do for both for them and for your customers is to reassure them that doing so is safe, that it doesn't risk spreading the disease, that they're not at risk coming to work. The process to do that is exactly the same as any other hazard that you might have in your business, whatever that might be. And the risk assessment process is absolutely built for this. And I'm sure every single business will have experience of doing risk assessments. This one's going to be a bit different. You've probably not done a risk assessment that's about an infectious disease in the past, but the process is the same. We recommend four steps that you should go through, quite simple steps. You've got to assess it, you've got to manage it, you've got to communicate what you find, and you then have a responsibility to keep colleagues updated on what you're doing and review your findings. On the right, I've just stuck in there a little poster that the health and safety executive have put together, which just confirms here's the steps we've taken to keep this place safe. You'll see down in the bottom left as well just a link to our coronavirus advice content. It's there for free, and it does include, one of the things we've done there is to provide a template risk assessment. So if you're not quite sure on exactly what questions you should be asking in your risk assessment, just take a look at that page. Be able to get to the example risk assessment. There'll be lots in there that isn't relevant for you, but just cross it out. Find the bits that are relevant, and hopefully a fairly nice, easy process. Okay, so that's stage one. Every business is going to be different. The risks that you face are going to be different. The way you manage them are going to be different, and it's your responsibility as you start up your businesses to make sure you've done that process effectively. Okay, so social distancing. This is something that every business is going to have to apply. Again, we've put together some content here on helping you to understand how that should work in your business. There's clearly a bit of debate going on around whether 2 meters is the right distance. Other countries are doing different things. And certainly when we start to get into the hospitality sector, it does seem pretty obvious that 2 meters really isn't going to work there. But for many retail spaces, it's okay with a bit of effort, and many have been open throughout operating those processes. So whether that's kind of traffic direction signs, the footprints you see on the floor, whether it's screens in front of your colleagues to keep them separated from the public as they come in. There's lots of measures you can do, and also there's lots of materials you can buy. So again, if you need advice on how to set up social distancing, and if you need advice on what are the correct products to put in place, you can just take a look at our website, and that'll help you. If they do choose to change the guidance from 2 meters to something else, so we haven't half got some work to do to change all the signs that we've been busy preparing for recent weeks. So that's social distancing, but something that I think probably every one of you on the call will need to do something with. Cleaning again is something that will need to be different. If you want to learn a new word this morning, fomites. This is the technical term, but these are the things that you can catch the virus off, and there are many. Everyone probably knows that things like it's doorknobs, it's banisters on stairs, door handles, those kind of things that are probably the worst culprits in spreading this kind of virus. But you need to understand in your workplace what are those places where the virus could settle and people could then touch those, and you need to have a cleaning regime in which whatever frequency is appropriate based on the traffic that you have, is making sure that those areas are decontaminated. So this could look really different from the way you cleaned your business previously, and you may need to think about using different materials to be absolutely confident that you're using cleaning materials that are going to kill the virus. You might have seen a few weeks back some news about when the world tried to respond to the absence of hand sanitizer. all sorts of people started making hand sanitizer in their sheds, in their businesses, and a lot of it wasn't the right strength and wouldn't kill the virus. So you need to make yourself really comfortable that the products that you're using are appropriate. And again, if you want some advice on that, I'd point you towards the link on the bottom of the page to understand exactly which cleaning chemicals and cleaning regimes are required to make your workplace safe. Next, to start talking about PPE. This has been a fairly extraordinary period for PPE. It's an acronym that's been on the kind of the headlines, front page of the newspapers. People understand what PPE is, what it stands for nowadays, and may well never have heard of it before. And you may have to think about PPE in your workplace if you can't achieve appropriate separation between people, if you can't guarantee that the virus won't be spread with the other protocols you have in place, then PPE may be kind of appropriate last resort to keep your colleagues safe. I would say that the PPE demand for the last few weeks has been almost infinite, and the NHS, rightly so, has consumed a lot of product. So you will find that some things, I've kind of called out 3 on the page here, but some of the kind of industrial respirators are very hard to come by. Coveralls are very hard to come by, and nitrile gloves that you see on the right, also very difficult to come by. Kind of stemming out of both infinite demand, but also a lot of the countries that produce this product shutting down themselves and the supply chain being disrupted. So if you do find that you've got demand for something that you can't find, give us a call and we'll help you to try and navigate around that and find a suitable alternative for maybe something you used before, or if you're not clear exactly what you should be using and what specification, again, give us a call and we'll help you through that selection. And face masks seems to be the one that probably confuses people most. There are many different types of face masks out there. People may not understand the differences between them. I've just put some pictures there that the ones that you maybe saw before in industry, respirators. Respirators are designed to protect you, the wearer, from a hazard that's outside in front of your face. Face masks don't do that. That's what you see people wearing in clinical environments. They're not designed to protect you. They're designed to protect the people around you from you. And there's lots of different numbers and letters that you might have started seeing. So the FFP1, P2, P3 are the respirator types that you see on the right-hand side. And the numbers basically describe the degree of protection that they provide. So really, P2s and P3s are the ones that will protect you against coronavirus, but they do need to be face fit tested. And for most businesses, they're just not required. You may have a risk assessment and a chemical or a hazard in your business that needs it. But in the main, most businesses, and certainly members of the public, should not be using respirators, especially ones that have a valve on them. And you'll have seen this in the queue at Sainsbury's or wherever you shop, people popping on a respirator from the shed and coming and walking around the supermarket with a mask with an outlet valve on it. And that's the same as having a hole in the respirator. You're just breathing straight out through that hole, not achieving anything. Type 1s, Type 2s, Type 2Rs, they're the different kinds of face masks that you see on the left. So designed for clinical environments. The R is about splash resistance. So if you see a mask that's got Type 2R on it, that really is one that's designed for clinical use, where there's a risk of body fluids, not to put too fine a point on it. So kind of aerosols of body fluids getting onto the masks. Again, Type 2Rs, really, you should be leaving those alone for the NHS and frontline workers to be using. But Type 2s, perfectly appropriate for people to be using in kind of normal workplaces, or for the public kind of going about their business. You then see that you may well have come across N95s, KF94s, KN95s. You may well have had these things advertised to you on Facebook or on Google Ads. Don't buy them is the simple advice. These are the international codes. If you happen to work in an intensive care unit, then an N95 might be okay. But KF94 is Korean, KN95 is Chinese. They are not allowed to be sold in this country, and you shouldn't buy them. And there are millions of these already in circulation in the country. It is an enormous problem. And please, whatever you do, don't get sucked into buying products which will not work, will not protect people, and are not allowed. All that stuff is really, really difficult to wrap your head around sometimes. So we've produced some advice to help with that. I've just done a little picture of it on the right-hand side of the page. So if you want some more guidance on what the right face mask is for you, then go and have a look at that page. You'll also be aware that the guidance for the public is now about face coverings, not face masks, and these can be made from anything pretty much. They're designed not to protect you, the wearer, but to protect the people around you should you be a kind of asymptomatic carrier of the virus. If you do want to use those in your business, I would recommend that you take a look at buying something of some decent quality, and not just asking your colleagues to knock up their own versions from a pair of old socks. It's not a great look from a professional point of view, but also, what kind of quality or standard might you be getting from that pair of socks? So if you are going to take that route, I would recommend that you track down a decent quality face covering, and you don't need to pay through the nose for those. They're not too expensive. Okay, so that's face masks and face coverings. The slide isn't moving along for me. There we go. So next, hand hygiene. This is by far the most important thing you can do. If your colleagues are not properly trained, and you've not got some signs up in your restrooms of how to wash your hands, then really important that you do so. It is the most effective thing by far in stopping the spread of the disease. And if you need some guidance on where you should be thinking about putting kind of hand sanitizing solutions, if you need those, then there's a bit of a graphic on the right hand side that can help you to do that. And again, watch out for the right product here. There's plenty of hand sanitizer on the market that isn't high enough in alcohol content, that doesn't kill coronavirus. Absolutely no point wasting your money on that, because it will have no effect whatsoever. So you need the right concentration, the right product, to make sure you're buying the right thing from a good supplier. Okay, that is hand hygiene. And then my final slide is just a bit of a word of warning about fake stuff. The scarcity of PPE over recent weeks has caused many people who've never provided PPE to kind of jump on the opportunity to source product that they don't really understand. A lot of it from China. There is enormous quantities of fake stuff, and some of it really dangerously fake, so things that just does not perform. So this isn't about those KN95 kind of things that I was mentioning before. They're not fake, they're just not appropriate. But there is plenty of stuff out there that is proper fake, never going to work. And also, probably even more so, is product that just is really low quality and just doesn't comply. Now, for you to reassure yourself that the stuff that you're buying is compliant and is not fake, it's not easy. There are a couple of steps to it. You need to ask for the documentation that goes with it. You need to see a CE certificate. You need to see a declaration of conformity. But there are many of these out there that are fake. So again, we've provided some guidance. If you feel you need it, there's a document you can download from our website that will help you through the process to reassure yourself that anything that you're buying is the right stuff. Okay, so please don't get caught out with buying equipment that is not going to work. Okay, that was all I wanted to cover today. So I'll stop talking now and kind of pass back control to take any questions you have.
Thank you very much, Adam, for that. Certainly some sort of very interesting bits, especially when we're talking about the face masks. It's something which is in the news a lot at the moment. Certainly seen a lot of, so some really good information there, especially with what each of the different codes mean. So in terms of questions, we've just got the one question, and it's a very quick question about gloves and the need for gloves and how they, whether there's the same sort of rules and regulations in regards to those. Is that something? Yeah,
I mean, the way a lot of people are using gloves at the moment is really not very appropriate. So there's not many cases where hand washing is not the right solution, and gloves is not the way to go. There are some, but in the main, you should be implementing a really good hand washing regime in your business. But when you see people kind of going to the supermarket wearing their leather gloves or their kind of work gloves, gloves that are worn for this purpose need to be thrown away. They need to be thrown away immediately after you've used them. And when they've potentially come into contact with a contaminated surface, they need to be thrown away. So if you're going to the supermarket wearing your gloves, I bet you're not throwing away your nice pair of leather gloves at the end of your visit to the supermarket. You're taking them home, you're popping them back on, you go into another shop, spreading the virus around there. You're probably going to touch your face with those gloves later on. You're not going to take them off in a way that's going to keep the virus away from you. So there are times when gloves are appropriate if it's unavoidable that a cleaning regime can't get round a potentially contaminated workplace quickly enough. But in the main, hand sanitizing and hand washing is where you should be going.
Thank you very much. I say thank you very much, Adam, for such a informative presentation there. So we've got no other questions at the moment, but if you do have any questions that you want to ask, please do put them in the question section, and we can come back to them at the end of the presentation. There's a bit of time built into the end of the presentation where I'll be able to take questions going forward. But as I say, thank you very much, Adam, for as I say, such a formative part there. The only other thing we've had come through is it's been asked whether the presentation will be available afterwards. Yes, if you contact the Humber Growth Hub, they should be able to provide you with the presentation. It is being recorded as well, so you should be able to look back on this and be able to re-review this at a later stage going forward. Okay, so I'm going to move on to the next part of the presentation today. I'm going to be talking to you a little bit more about sort of the risk assessments and a few of the key things that you might need to put in place. So just as a quick introduction to myself, I'm a senior business advisor for Blue Orchid, a NEBOSH health and safety advisor. And what I want to take you through really is some practical means, some practical ways that you can actually implement what you need to do going forward. I've had my own business. I've had to go through and do all the risk assessments myself, and I've looked through what people actually need and how it actually works. And so what I'm going to be looking at here is not necessarily saying you've got to complete this massive piece of paper with all these tick boxes in to show that you're compliant, as much as let's practically put that to a document which is usable. So what I've planned to go through today, basically, I'm going to say, is building upon what Adam's been going through. So I want to talk a bit about sort of a few tick boxes when you can open, what you need to do there, what is social distances, as Adam's sort of been through. But the main thing I want to focus on is that risk assessment and how do you actually do it? Because you, as the business owner, manager, etc., are the people who need to be doing this one. You're the people who know the business, and so you need to be doing this one. And so that's what I'm looking at focusing on. Then going to talk through sort of some of the government guidance. The government have put together several documents to talk about how people need to be COVID secure in different environments, from offices to factories to vehicles to retail, hospitality, etc. So I want to go through what they actually say. What are their points? What are they saying that you need to do, and how you can implement them into your risk assessments and into your workplace. The final thing I'm going to go through really is that communication and the changing environment, because a lot of what we're going to be talking about is actually people's perception, and people's perception is what you need to convince. You need to convince people that things are safe so that they come into your shop, so they come into your place of work, so they come in and buy from you. Because if they do not feel safe, they will not come into your shop. So let's start off with when people can reopen. Well, we've already seen lots of shops open, and a lot of retail shops have been open, because if they're essential shops, so supermarkets, things like that, they have remained open through COVID-19. Through the whole close down, through the whole lockdown, they have remained open. So essential shops have remained open. And we need to take a look at what they've done, what they've learned over this period of time. Outdoor markets and car showrooms were allowed to open on the 1st of June. And I've certainly seen lots of sort of car showrooms, emails and that from saying, we're now open and come and see us. One of the reasons that they were allowed to open first is because they're outdoors. They've got the space. If you think about car showrooms, they're usually big areas that can implement social distancing fairly easily. All non-essential retail has been confirmed that they can open from the 15th of June. And other shops, hospitality, things like that, we hope will open from the 4th of July, but we don't know that for sure at the moment. So most businesses are starting to reopen. They are starting to reopen, but there will be changes. They will have to open a different way. And people have changed. Shopping habits have changed, and you need to take this into account. So, okay, what is social distancing? Well, Adam's kind of been through this, so I won't dwell on it too much. And we all know what social distancing is. It's basically just keeping that physical distance between people, and it's to stop the spread, because droplets from your breath, from coughing, from sneezing, but just generally talking, generally breathing will transpire, will transfer in an area. Currently, government recommends 2 meters, and like Adam said, there's a lot of debate upon that at the moment. Personally, I think it will come down to 1 meter at some point, but it hasn't yet, and it doesn't look like it will do for the next foreseeable few weeks. So you've got to look at the 2 meter rule. Don't bank on anything changing at the moment. As I say, I think it will be a phased return, a phased brought back, but at the moment it is 2 meters or 6'6", 6.5 meters, 6.5 feet. You do need to keep apart from other people. That's the government's recommendation. And it is there just to stop that spread. And there's lots of talk and lots of mathematical theories of how that reduces the spread. And if you want to look at them, go ahead and look at them. But the further you are apart, the less the spread is going to be. So if you can actually increase that 2 meters, even better, but you want to be that sort of minimum of 2 meters. One of the things I've wanted to make a point of here is it's that reassurance. Is that safe? And the government saying that 2 meters is safe, it's what people feel safe. So they might want to be further than that. I'm sure you've seen some people who've dived into a bush or something as you've been walking along because they want to be further than that 2 meters. And that's something you've got to think about. That's something you've got to think about when you're looking at reopening your shops, looking at reopening your premises, that people need to feel safe. regardless of what the guideline says, you may have to go above and beyond to make people feel safe. So who are you there to protect? What is the reason for this? Well, nothing's changed with health and safety. Health and safety hasn't changed because of COVID-19. It's just a new threat that you have to take into account. So I've put on here Section 2 of the Health and Safety at Work Act says that you must protect your employees. That is a general responsibility from the Health and Safety at Work Act that you have to do that in all cases. All it is now is the fact that COVID-19 is a new risk. It's something we haven't had to think about before. So we're going to have to go, right, we've got a new risk. So therefore we need to do a new risk assessment and we need to see how we are going to protect people from this one. So there's been nothing superseded here. The reporting process exactly the same. The enforcing bodies are exactly the same. The processes are exactly the same. So I'm going to say, theoretically, you don't need to change anything. All you need to do is assess the risk, see what you need to do, and put measures in place to reduce that new risk. It's no different to having a change around in your shop or anything like that. It's a new risk. So don't get too worried about what do I need to do? How do I do it? Go back to what you've already done. Have a look at what you've done there and just implement that going forward. So who are we protecting? Well, your workforce is the main one here. So what do we need to look at? Well, first of all, one of the easiest things we need to do is straightforward. Ask staff who show any symptoms not to attend work. That's the first and probably the most important part of any sort of managing any of this risk. We need to make sure it's easy reporting, clear written communication, and reminders to staff. Clear, consistent enforcement measures and access to PPE and welfare facilities when required. But this is all based upon your risk assessment, and your risk assessment will tell you exactly what you need to do. And as I said, that's the main thing that I actually want to go through today, is how to do that risk assessment. What do you need to do? What are the points that you need to do? You need to consider, and how do you actually implement them? One of the things I'm going to point out here is RIDDOR. So this is something you probably may not have come across before, but you may have done. And RIDDOR is basically reporting of dangerous occurrences and sort of injuries within the workplace. It's something which you see in construction quite a bit, because there's obviously a higher rate of risk involved there and dangerous occurrences. But COVID-19 actually is covered by RIDDOR. So I've put there a little bit of a definition there and what needs to be done. So it's basically if there's an unintended incident at work that has led to somebody's possible actual exposure to coronavirus, must be reported as a dangerous occurrence. For most people, that's not going to be something you need to worry about, but it's something to be aware of. And we've heard a lot about this track and trace and things like that. And that's really what this is here for. That's why this is included, is basically if there is an incident at work that involves coronavirus, for one reason or another, it needs to be reported so that people can be tracked, so they can be traced, and therefore we can reduce that spread. If you want more information about RIDDOR, there's some great information on the HSE's website about how you go about the reporting thing. There is also more information with the track and trace, and anybody who has or suspected of contracting coronavirus needs to report that to the relevant body so that they can be tested and the track and trace initiated. They have extended RIDDOR, some of the definitions there, if you look at the government guidance, right up to if a worker dies as a result of occupation exposure. I'm not going to go into that one because I really don't think that's highly likely for anybody on here. And if you're putting things in place, really, It's only that first one that ever really comes into play at any point here. The next people we need to think about are your customers. You have a right and a duty to protect your customers in the same way as your employees. They have the same rights in terms of that. So customers need to feel safe. And I know I keep going back to this point, but at the end of the day, if customers don't want to come into your premises, if customers don't want to buy from you for one reason or another, they won't. They'll just go somewhere else. A lot of the times I hear about people being, I'm going to say, self-employed or having their own business in the terms of be their own boss. When in some ways you're not. Your boss is your customers. The only difference is they don't tell you if they're not happy with something. What they do is just go somewhere else. And it's very difficult for you to know that they've just gone somewhere else. So one of the things I want to make a point here is do your research, speak to people, see what they expect in terms of the social distancing, what they expect in terms of what measures you need to put in place. And they're as important as anybody else. They're as important of what the government are saying you have to do. They're as important of what your risk assessment says you have to do. But a lot of the time you may need to go above and beyond what that is, especially when we're looking at high streets and retail, because the news and all things like that will influence what people's thoughts are. So you do need to think about that one, and you do need to make them feel safe. Okay, so the main part of this one is risk assessments, and as I say, this is what I wanted to talk about the most. I wanted to go through how to do a risk assessment, and as Adam said on the ARCO website, there is a sort of sample risk assessment that you can just download and I'm going to say use, but you use it as a template. That's the first thing I want to say. It's a template. It's not one that's done for you. It's not a print off and put in a drawer. It's a template for you to update. And that's a point with risk assessments. Risk assessments should be probably one of the most thumbed, used pieces of paperwork in any business. And if they're not, ask yourself why. Because the only way a risk assessment actually works is by it being read. If people don't know what happens, if people don't know what you've put in place, then they're not going to implement it. So it needs to be a document that's read. And how long does it need to be is one of the questions I get asked. Well, it needs to be in a format that's going to be read. So don't worry about having a 50-page risk assessment or having a 1-page risk assessment. As long as it covers the risks, as long as it covers the hazards, as long as it covers what you're going to do, and as long as people look at it, I would actually say a smaller one is better than a larger one. It needs to cover the essentials, but it also needs to be read. So make sure it's readable and don't do it as a tick box exercise. Never file it away and never look at it. It's something which almost should be out on the desk. I see lots of people advertising, I'll do you a COVID-19 risk assessment for X, Y, and Z cost, and I'll send it over to you. I think there's going to be a clampdown on that coming up. I think there should be a clampdown on that coming up, simply because a lot of people will be taking those, filing them away and saying, I'm safe now. Well, you know safer than you were before. All you've done is paid some money out. So why pay that money out? Do it yourself, especially as there's some really good templates out there for free, like ARCO are doing. So do it yourself. You're the person who knows the risk. You're the person who knows your business. You're the people who know your customers. So you need to be able to do it yourself, and it is fairly straightforward to do. The final thing I want to say here is communicate it. Like Adam said, that's the final part of any risk assessment. It needs to be communicated. And that may not be in next paper format. That may be in the sign of signs, social media, or anything like that. It needs to be communicated. So let's go through a risk assessment and let's see what we need to do for one. Okay, so just to talk about format. So lots of templates out there. I'm going to say some better than others, I would say, but lots and lots of templates out there. Don't worry about the format too much. Just make sure it covers these points. And I'll go through these points in terms of in order I've put them in. So first of all, we identify the hazard. So we look around the workplace. So what I'd suggest you do is take a clipboard out, pen, paper, and pretend you're a customer or pretend you're one of your staff and have a walk around. There you can go through and say, well, right, to get in, I need to open a door. Right, okay, there's a hazard there that is transfer of COVID via door handles. We've got a door there, okay. Then they're going to go and do this, and you just go through the process. It's going through and just with that clipboard and noting down anything you can say, go, yep, there's that, there's that, there's that there. And just make a list. It's the first stage, make a list of all those points, all the touch points that you can see, all the little bits that you can say, what happens if? And it's a bit like when you go into a room. If you walk into your room, especially if I walked into my son's bedroom, I'd be going, well, what's the risk? Well, shoes on the floor, toys there. Right, I'll move that out. I'll push that glass onto his bedside table more because I'm going to knock it off. That's doing a risk assessment. You're looking for things that could go wrong. The next stage we do is we look at persons at risk. Who is it? Who could be affected? So as we're going around, we say there's a stock room, there's a door there. Well, the person who's going to be affected is anybody going into that stock room. Okay, who's going to be going into that stock room? Not customers, so we don't have to put customers down, staff, etc., etc. So we can have a look at the people at risk. And when we start looking at the control measures we put in place, that's extremely important because the lower the number of people at risk, the easier it is to control. For example, let's say we're looking at stock rooms. Maybe we say, well, we've got to open 2 doors to get into a stock room and all staff have access to it. Well, maybe we could limit access from staff. So there's a stock control person who goes in and gets the stock. So there's only ever one person opening those doors. That has reduced the risk. So knowing who is at risk is extremely important. The next bit we're talking about here is evaluation. Evaluation of the risk level. This can be done in many different ways. The way I like to do it, and the way I find most easy, and I'm somebody I like to simplify things, is I come up with 2 numbers and I add them together. And that's all I need is 2 numbers to see what the problem is. So the 2 numbers, first of all, is what is the likelihood of that risk taking place? So I put a number from 0 to 10. I like 0 to 10. I know the government seemed to like 1 to 5, but I like 1 to 10. And I put in what is the likelihood of that risk taking place. So let's take your door coming into your shop. What is the likelihood of somebody having to touch that door and there being coronavirus on there? Well, I'm going to say the chances of somebody having to touch the door, if it's a manual door, is fairly high, bit lower for the fact that coronavirus may not be on there. So therefore, with no measures in place, I would probably put it at about a 7, maybe an 8 in terms of the risk level. So that's quite high. The next number we put on is what is the risk of somebody falling ill from that one? Well, I'm going to say that is still at a reasonably high level if the virus is on there, because we know it stays on surfaces for around about 72 hours is what the current thoughts are, and we know that it's a highly transmittable disease. So I'm going to say let's put that, for argument's sake, at 6 at the moment. What that means is you can add the 2 together and see how high your risk number is. If the risk number is too high, then we shouldn't be doing it. If the risk number is really low, good. And what we're looking at trying to do is reduce those numbers down. So let's take the same scenario again and say, well, let's change it around. Let's put an automatic door in, for example. I know that's a fairly large investment, but for argument's sake, we're going to put an automatic door in. What's that number now become for the first risk? What's the chances of somebody touching that door? Well, I'd say 0 to 1 because it's automatic. Therefore, that has reduced those numbers down and means the risk is almost 0 again. Those playing around with those numbers and seeing what you can do with them help you easily identify the areas you need to take action with. And you always take action with those higher numbers first. To do each of the hazards that you've seen, you identify the level of risk, you evaluate the level of risk with the numbers, and you go through trying to bring those numbers down. Other things that you could do is say, well, I can't put an electric door in, I can't put an automatic door in. So what I'm going to do is I'm going to put hand sanitizer before and after the door so people can use hand sanitizer. The chances of them touching that door is still at that 7 or 8, but then the chances of them contracting COVID-19 from that, because they're using hand sanitizer, say straight after it, is suddenly gone from 6 or 7 down to 1 or 2. Again, you've reduced that risk down. As I say, it's an easy visual aspect to see what areas you need to look at and in which order you need to reduce it down. You're trying to get all of them down to 0 ideally, but as I say, that's almost an impossible task to do. The next thing we're looking at doing is recording the assessments and findings. Now, for most businesses, you have to do that written down. And I'm going to say for all businesses, you should do that written down. If you have less than 5 employees under the Health and Safety at Work Act and that, you do not have to write a risk assessment down. But you still have to do one, which is a little bit of a chicken and egg situation, because if you're going to do one, you may as well write it down and it shows what you're doing. Because like we said before, communication is the most key aspect of this. And if you don't write it down, how do you communicate it? If you don't write it down, how do you prove you've done it? So although a lot of people say, I don't need to do a risk assessment because I'm less than 5 employees. No, that's not true. You still need to do a risk assessment. The difference is you don't have to write it down, but why not? You should do. It's good practice too. So I'm going to say everybody needs to write these down. Everybody needs to have a file of these, of what they've done and how they've communicated them. And I like to see these displayed somewhere. I think, especially at this time, the moment when we're talking about making people feel safe, I would actually be putting them up on my website and things like that, so that people can actually see what you've done. Going back, we have to make sure we protect our staff. Basically, what it says is staff do not have to return to an unsafe workplace. Most of the time, you will have made the workplace safe because you won't want to have an unsafe workplace. But if staff are saying they don't want to return because of an unsafe workplace, it's usually because they just don't feel safe. So you haven't done the communication part of it. You may have done the implementation part, but the communication part of it may be what's lacking here. And just sharing what you've done may solve that issue. Risks do change. We've seen that over time. We know this is a new one. We know cases are falling and therefore risks are changing. So you need to monitor and you need to review it. And that's like what I said, the 2-meter rule may well change in the future. But does that mean you change what you do? You're the one who has to make that decision, even if guidance changes. And this could be, again, based upon communication, based upon feelings, based upon your workplace. So you always monitor and review it. It is a working document. It is theoretically never, ever finished. And that's why I say it should be the most thumbed, dirtiest, used document in your workplace, because the only way that people are going to adhere to it is by using it, by reading it, by putting measures in place. It's a bit like we all know to stop at a red light. The reason we all know to stop at a red light is because it's been ingrained in us, in our psyche from a young age. When I take my lad out for a cycle who's 8 years old, I say to him, you stop at a red light. So by the time he gets to a driving age, he'll know he has to stop at a red light. Nobody has to tell him that. He'll know that. Same with your risk assessment. Keep reinforcing that so that it becomes natural. it becomes second nature and people don't have to think about what they're doing. So I'm going to go through sort of measures that you can take in place. And I just want to start off with a few pictures. Most of them I've nicked off from BBC, but I thought I'd just kind of give a bit of an idea. What will the workplace look like going forward? Well, it's going to be very, very different. Shops are going to be very different. And if you think about 2 meters, it is actually quite a long way. So we need to look at ways we can implement that, which are going to be sensible. So just a very quick couple here. The first one's from a restaurant of what they intend to do. I think this one might be in Italy. They're also sort of playing music of people talking and things like that to make it feel like it was before. Because again, like I said to you, you've got to make people feel confident. At the moment, would I want to go out for a meal, even if restaurants are not opened? Probably not. The reason I wouldn't is because not necessarily I wouldn't feel safe. But equally, let's look at the second picture there. Would I really want to sit in an environment like that? Now, if that was my canteen for lunch and I worked in a factory, that's my canteen for lunch. It's you're doing something, you just got to get on with it. That's lunch. But would I go and pay for a meal and sit in that situation? It's not the same reason I would have gone out previously. So again, think about how things look, and especially when we're talking about queuing systems. A lot of the time, and I'm sure all of you have done it, you've gone to a shop and gone, looked at the queue and gone, how many people? But there's only about 10 people in the queue, but they're all standing 2 meters apart. How does it look? So you need to take those sort of things into account. The couple here I've put in, I think these look a little bit more realistic, a little bit more tidy. And I've certainly seen screens and barriers now coming about which actually look reasonable and actually make it look not quite so bad. The one on the left here with the panda, I absolutely love this one. I think this is the best one of the lot. And I think this was in Singapore. A restaurant basically just put a panda in every other seat to stop people from sitting in those seats, to enforce that social distancing. And I just think that's brilliant. What they've done there is they've actually made a point. They've enforced the social distancing, but they've done it in a way that's still fun. And I would much rather go to a place like that than one, say, in the previous slide. So think outside the box. Think about what people feel like, and sometimes embrace it and make a point of it and make it fun. So think what you need to do. The very final one is this one here. And I just wanted to put this one in, and this is in Germany. I just love this one. How to really enforce social distance. And I'll leave that one with you just to, just because it's fun. Whether you'll ever get anybody doing that, whether that will be the new normal, hey, who knows? Stranger things have happened, but as I say, think outside the box. So what are the key points that we need to consider? So this part of it now, I want to go through the main aspects from the advice that the government have put out. So first of all, I'm going to say on the .gov.uk website, there are a number of different papers that they put on about returning to work and being COVID secure. There is one based upon retail, and that's what I've taken most of this from. So it's around about a 30 or 40 page document going through what you need to do. I would suggest everybody takes a look at that. It's not the most interesting reading, I will say. So, you know, good bedtime reading, but have a look at this one because it does go through some really good points. I've tried to summarize them here so that people can take the main points away and sort of answer some of the questions that they've put in there because some of the bits aren't 100% clear. So first of all, the key points that go through all of these documents. You need to consider all aspects of your workplace. So this does still include car parks, break rooms, washrooms, entrances. You also need to think about how people get to work, to and from work. That needs to be something you need to think about, because again, that if you think about safety, if you think about whether people want to return to work, whether your customers want to come into you, you need to think about how people get to you. If any employee shows symptoms of COVID-19, no matter how small, they should not attend work. So one of the things you might need to look at here is your sickness policy. What does that mean? How does that affect people? What is the reporting process of people who have symptoms? And how do you enforce that? There's something you need to look at. Policies you need to review here are going to be not just the risk assessment for COVID-19, it's going to be your other policies as well. And as I say, your sickness and reporting policy is going to be one of them. You must remember you still cannot discriminate. That hasn't changed. I mean, it's very topical at the moment, but don't discriminate against anybody, whether they're pregnant, whether they're, it doesn't matter. You cannot discriminate against anybody. So that it needs to be a whole encompassing policy. The other thing is, if we can't social distance, if that isn't able to be put in place, does that activity need to take place? And that can include, does your shop need to open? There will be enforcement measures in place for shops that do not adhere to the social distancing rules that they've put out. So you do need to consider that of how you implement it. And if you can't implement it, does that need to take place? So this might be individual aspects of your business. You might need to change your business. Your business plan may need to change or will need to change at this point. So, okay, let's have a look at each section we might have to include within our risk assessment. As I say, go through with a clipboard and go through each area of your business, go through each activity of your business and see how it's affected. I'm going to pick on 2 or 3. The first one being employees. So, like I said to you, come up with those numbers. So the 0 to 10. 0 means no risk, and that's the perfect one. That's the ideal one. That's what we need to get to, ideally. As I say, almost impossible, but ideally we need to. The easiest way of getting to that 0 on either of those 2 numbers that we've come up with is removing the risk. Easiest way of removing the risk, don't have it. So for employees, it's still tell them to work from home. Now, I know from a retail point of view, that's very, very difficult to do. But let's look at certain aspects of your business. Do all your employees need to be in? Does your back office, for example, need to be in? So let's say you've got a bookkeeper who comes into your shop once a week. Well, can they not do it from home? That removes that part of the risk, which reduces it down. Does everybody need to return to front-facing working? If you can't remove the risk from working from home, we need to reduce it. Easy ways of doing that one. The very first one, when we're looking at employees, is trying to reduce congestion, reduce those pinch points, reduce the areas where people are close together. So that might be when shifts start. You might have shifts starting at different times. Does everybody need to be there from opening of the shop? Does everybody need to be there at that specific time? Or can you stagger the opening of, or stagger the arrival times just by 10, 15 minutes, so that cloakroom, that entrance doesn't get clogged up with staff? Always, and I know this has been point made several times, but always provide hand washing and sanitization facilities. Yes, that does reduce the risk, but it also increases confidence, that ability to wash your hands. And I know there's conversations and talk earlier about sort of hand sanitizer, whether it's got the right alcohol content, etc., etc. They still say the best way is soap and water. So make sure staff have good access to hand sanitizer or hand washing facilities. And this should be on entrance, exit points, start and end of any shifts. So I personally, one of the things I'd be putting in place is making sure people come in and wash their hands before they do anything else. So start of the shift. Then any transfer that they may have on their way into work, hopefully will be reduced down. Reduced touch points. Now I've put swipe cards, ID cards. So I know a lot of businesses will have clocking in terms of swipe cards and things like that. Well, can we reduce that down? Because they're touch points. Yeah, can it be now more your tick register? Somebody has to tick register. So they go through, oh yeah, so-and-so's here, so-and-so's here, so-and-so's here. That reduces down those touch points. Same with doors and things like that. Yeah, do those doors need to be closed at all times? Or can the first person who was in the morning open up the staff entrance door and people can come and go without having to have those touch points? Like I said before, reduce movement. So we said about stock rooms, and maybe you've got somebody who deals with that stock room. Well, maybe we can use things like radios, and these are fairly cheap to buy. You can go and buy radios for 20 quid from Argos or whatever, and then hopefully that will reduce the traveling around the store, traveling around your workplace, so that A, it becomes more efficient, and B, it reduces movement around. And that's something when we're looking at risk assessments, and a lot of people are saying this is going to be unmanageable. How are we going? We're not going to have as many people. It's going to take us longer. But some things we can put in place may actually increase our productivity. Certainly now, how many of you will finish this Zoom call, go and have lunch, and be back at your desk within a short period of time? It's made things more efficient at times, not all the time. I will admit, not all the time. But let's look at those small efficiency savings, which offset some of the less efficient practices that we're going to have to implement. And radios, I think, are one of the key ones that may increase efficiency going forward. We might have to look at one-way systems for movement, especially when we're looking at shops and people moving around in shops. I will talk about customers separately. But in terms of staff as well, we may need to look at one-way systems, entrances and exits, so that people aren't passing in corridors, people aren't passing on stairs, so that you have an up and a down, things like that. Have a look at how those can be implemented. If they can't be implemented, we might need to look at communication methods. And from the very straightforward, it might be a case of when you're starting to come down the stairs, holler out so that anybody who's looking at coming up the stairs knows to wait. And you have a right of way as the person coming down or the person going up. That's established beforehand, so it's nice and clear. There are ways around it. We don't have to have certain one-way systems if we can do it in another manner. And I know a lot of shops, a lot of businesses aren't set out to be in the one-way systems. I've put uniforms on here as well. The reason I put uniforms on, they have one of the things that's in the documentation is increased washing of clothes after work, before work, etc., etc. So that there's more change of clothes, because the virus can survive on clothes for a period of time. You may need to look at what uniforms you're providing, and you may need to provide more uniform for your staff so that they can change more often. And it's something to bear in mind here. One of the easiest ones to do here is assign workstations or work areas to certain staff. So let's say a till, and a till is probably the easiest option here. Assign staff to that till so that on that shift, that member of staff is the only person who can use that till. At the end of the shift, that gets cleaned and the next person can move in. It's a bit like hot desking, and some of the advice on hot desking is to avoid it where possible. And that's in essence what you're doing here. You're avoiding that movement around. So have a station for somebody, have an aisle for somebody that they look after. So there's less interaction between staff members. If there is high risk areas, you may need to look at screens, but these are always going to be a last resort. We work from this top of this page down, we remove the risk, we then reduce the risk. And the very final thing is we put things in place, such as screens and workplaces. Because let's go back to those pictures. We don't all want to be sat in an area behind screens, but there may be that area that's necessary for that to take place. The obvious one here is going to be your tills, because you've got lots of members of the public coming past you. Putting that screen up is a very easy way to reduce the risk dramatically in that instance. But it's not the first thing you need to think about. Can you reduce it down? And an easier option than that is maybe unmanned tills, self-checkouts. Well, self-checkouts do not need the screens. They do not have the person, so therefore there is no risk. We've removed the risk totally. Okay, carrying on with employees, and I've said communication is extremely important. It is something you need to do. And I'm going to say on one hand, you're probably going to need to increase the number of toolbox talks you're going to have, the communication to staff. But equally, I'm going to say remove the risk, reduce the meetings. Now, yes, I sound like I'm contradicting myself, but what I'm actually going to do is say, look at the ways you communicate. Explain the reason you might be changing the communication. So you could move it online. Every one of you here is using online portals to communicate. My parents use online portals to communicate now. So let's try and integrate that into the workplace. Maybe your toolbox talk could be done via Zoom, GoToMeetings, WhatsApp even. But I would say you almost need to increase them, but look at other ways you can do it. Make sure the meetings are necessary. So have a clear agenda about those meetings and don't have unnecessary meetings. But meetings still need to take place. One of the other things you could do is maybe have them outside. Outside, there is more airflow. The risk is reduced. There's more space. And at this time, mental health is a big issue. There's certainly a link. There's already a proven link between being outside and mental health. So you're hopefully also increasing the mental health or improving the mental health of your staff and employees by moving outside. I know British weather, not always possible, but it is something to think about. And this kind of comes through when we start talking about other things like break rooms and that. Have a look at what space you've got. Have a look at how you can use it. Certainly, I'd rather sit under a tree and have my lunch, or sit under a tree and have a meeting than I would in some back office somewhere. Look at shared items, and I've kind of put this in here after meetings because a lot of the time it happens in meetings and sign in. You sign in for a meeting, or you sign to say you've understood something. You're signing to say that you've received some uniform. Well, you might have to look at ways of digitally doing this because that reduces those touch points down. So you don't want shared pens, you don't want shared clipboards. Again, assign them to an individual so that they have those methods. And the one thing I'm going to point out here is these things. Mobile phones and tablets are available. Yes, they're expensive. Yes, there's a cost to them. And it's something you may need to consider. But most people will have access to this, and a lot of businesses have access to this already. And I think we're going to see a growth in the use of more digital methods of recording and removing away from the pens, clipboards, etc. As I say, think about work, how people get to work, and this comes for customers as well. But think about encouraging the use of sort of cycling to work and stuff like that. You might need to look at putting things like bike racks in. That might improve the ability for people to use that, somewhere to store that sort of thing. So do encourage that. And again, I've put on there as a final thing, hand sanitizer, encourage its use. Get people to automatically do it as soon as they walk in. Get people to automatically do it before they leave. You know, at times of the day, have those aspects of that's when you use it. You know, tell people you must use it here, then, and etc., etc. But key thing is make people have the ability to use it. Does all employees, staff, especially shop front, will they need to sort of carry hand sanitizer around? I'm going to say that would be a good reassuring practice. It's something which isn't in any of the documentation, but like I said to you before, you're going to have to reassure your staff and members of the public. And a bit like the nurses wear those little things of hand sanitizer and that, maybe that's something which would give that reassurance, give that ability as well for it to be used at any point, and as a nice, easy visual aspect. So break rooms and canteens, okay, you know, they can still be used. Straightforward, they can still be used. Break rooms and canteens can still be used, but you've got to think about your occupancy levels. You've still got to think about that social distancing. So you need to manage those occupancy levels. So think about staggering break times so that you don't have a rush of people at one point. Like I said, encourage those breaks to be taken outside. Have you got an area outside which you can tidy up so that people can sit outside, take in the sun, taking a bit of fresh air, and again, it increases your capacity for those break rooms. Interestingly, one of the things it says in all the documents is about meals and about canteens. Now, I know a lot of businesses don't have that, especially if they're sort of city centre based, but it does say that if you can encourage people not to move off site, they're not interacting with other people and therefore reducing the risk, reducing the spread. So maybe have a look at somebody coming and providing some meals, you know, one of these sandwich vans coming along so that they come to you, so your staff aren't having to move off site. This also is a benefit to your staff. And if you have a benefit to your staff, then they are more likely to be happy in their work, happy in their job. Again, we're looking at that actually increasing efficiency, increasing your ability as a business. So do try and make it so that people don't have to go off site. So they still have these break rooms and canteens, just put things in place so that social distancing can still be maintained. You may need to look at what items there are shared, things like kettles and stuff like that, and mugs, and you need to look at the cleaning of these, and you will have to increase the sanitization of these areas. 2 ways I'd suggest you do this. First of all, make cleaning facilities available. So make sure there's a bottle of spray and a wipe or some Dettol wipes or something along those lines available for people to clean before and after use. Again, try and encourage that. How do we encourage it? Well, A, ask people to do it. B, put signs up. People do as they're told. There's a sign up, people generally tend to do it, especially if it's a good sign. So I say encourage that self-cleaning. People to take responsibility for themselves, but equally look at when you clean. You may need to increase your cleaning rota for before and after the main break times, the start and the end of the day, etc., etc. Have a look at when that is. One of the things I would suggest here is I'd also put up a sheet of paper saying when it was last cleaned. It's a very good visual reminder for people to do it, a bit like you often see in toilets in pubs and restaurants. There's the little sort of cleaning rota of when it was last checked. It shows a very good visual aspect. It's that reassurance again. And we're always going back to communication and reassurance. How do you make people feel safe? So access, egress, so entrance and exit points. As I say, I've gone through a lot of this, so I will sort of just very quickly go through, but this is more looking at employees again, about looking at those entrance and exit points. What I have put on here though is again going back to the signage. I've put there, use tape to reinforce social distancing. That's not just for queuing. I don't think that should be used just for queuing. I think we want to start seeing, well, we will start seeing that in places just to show what 2 meters is. Can anybody here tell me exactly, measure out what 2 meters is without using a tape measure? It's very, very difficult to do. And a bit like you see going down the motorway, you see the chevrons to say keep that far apart. That's how far apart it is. And how many of you have been down the motorway and gone, oh, actually, I'm a bit close. I need to pull back a little bit. Well, I think we're probably going to want to see that in shops. We're probably going to want to see that in workplaces, whether that's front of house, back of house, to help reinforce where people should be and what 2 meters is. And if it changes, and we just change things across. And especially if we just use a bit of tape like the chevrons, we just put an extra one in if it changes to 1 meter. It doesn't have to cost a fortune. It can be something which is done on a fairly budget-based aspect. It doesn't have to be anything more than just a bit of tape. So I would suggest having a look at that, how you can enforce or reinforce, I'm going to say, the measures that you put in place. Communication is important. So moving on now to customers and how do we manage customers? First thing for everybody here, have a look at the supermarkets that have been open, have a look at the shops that have been open, learn from them, see what they've done, see what they've put in place, because they'll have made mistakes, they'll have improved upon their mistakes. So have a look at what they've done and how they've improved. So main points of here, first one, encourage customers to use hand sanitizer. So have those points in place, have the self-cleaning areas in place. If we look at a lot of supermarkets, they have those cleaning stations where you can clean the trolleys and stuff like that. So encourage that use, because that obviously kills the virus. You may need to limit customers in at one time, and this comes down to your shop and how it's set out. Sometimes you can change it around so that you don't have to limit the numbers in as big a way as you think. So get a plan out, move things around, see how people move around the shop, and think about the areas that people stop at. So we might need to look at displays, offers and stuff like that. A lot of the time they're at the entrance to the shops. So people stop when they go in and go, oh, do I need an extra 4 tins of beans or whatever it is? You may need to move those around so they're not all in one place. So you don't have those choke points. But you also may need a member of staff managing that entrance and exit and making sure that you don't have more people in than you can cope with, which is with social distancing in place. It's a very difficult one to manage. And what I would suggest for everybody here is, again, think about that panda in that restaurant. Try and do it in a fun way. Try and do it in a way that isn't too, no, don't come in here, you can't come in here, too many people. It's, you know, have that sort of system in place. So maybe have, I don't know, some little signs to stand on, and maybe even you could put in little signs to stand on with some little puzzles on or something like that to encourage people to stand there and wait and not be bored going, don't know what to do. So think about some out of the box thinking here about how you get people to stand, I'm going to say stand in line, but wait until there's space within the shop. Encourage people to shop alone where possible, but you've got to be careful you don't discriminate here. And, you know, this discrimination, some people won't be able to shop alone. Maybe it's a lone parent and they can't go out without their children, etc., etc. So if you can encourage people to shop alone, then that reduces the numbers in the store. Clear guidance and communication, that is the most important thing. And when we start talking about people coming into your work, I would use all means possible. This is not just signage, but this is things like your social media feeds. This is things like your websites. So people know, A, that you're open and what you're doing in place. Example I'm going to use is there's one of these posh burger shops by me, for about 2 weeks, I knew they were open and I really fancied one. It was one of my favorite places to eat. But did I go there? No. The reason I didn't go there is because I couldn't work out how I picked up my order. I knew I could do it. I knew how to order. And they said social distance is in place, but they didn't really tell me how. So I was like, I don't want to go up there and find I'm not sure how to do it. One day I did do it, and it was all very nicely signed up, extremely easy and efficient to do. But I wasn't sure at that point until I got there. So use things like social media, use things like your websites to communicate regularly what you are doing and how people should react in your shop. Again, use of things like automatic doors to reduce contact points, leaving doors open is a much cheaper way than installing automatic doors and stuff, but you might have to look at your fire safety and stuff like that if you are doing those sort of things. Encourage people to come with shopping lists so that they're not spending the time in there. And this kind of comes back to the limited numbers. If you're limited numbers, less people coming through, less business in your shop possibly. So you need to speed up the use of your shop. So if they come with a shopping list, they're more likely to be quicker on their shopping. You get what they want. You can support that with your website, your social media, pre-adverts, shopping lists in Windows, etc., etc. Screens, possibly at checkouts, to do the one-way systems. The other thing you might need to do is try and reduce customer handling of merchandise. So this might be in ways of displays, a little bit more information about products, more posters about the products, ingredients lists if it's a shop selling food or anything like this, so that people aren't having to thumb through the areas. If it's clothing, you might have certain sizes with certain things, more mannequins with more displays on. It's anything like this to reduce that contact. You're trying to reduce contact at all points. You may need to look at putting protective coverings on certain items. So again, with clothing, you might have most of the clothing behind certain screens, etc., or coverings, or I put here sofas. You might have interchangeable covers that you can take off, wash, put back on, so we get more regular cleaning. And again, it helps reduce that spread down and make things easier to clean going forward. Question I've been asked a few times about fitting rooms. Can you reopen fitting rooms? Well, first things first, if they don't need to be open, don't open them. It is a high touch point, and like we said before, remove the risk. So do they need to be open, or can you do other means? Are there any other means? Now, it is extremely difficult. There aren't many other means, but this again might come down to more information, more sizing, more measurements, more mannequins. Anything like this may reduce the need for those fitting rooms. You may also want to look at your returns policy, so that again, maybe relax that so that people have the ability to return stuff, so they're not using those fitting rooms in the same way. They're taking the stuff away and then they can return it or feel it's easy to return. A bit like, why does everybody get your jumper from Marks and Spencer's at Christmas? Because their returns policy is easy. It can actually be a good sales tool, and it's something to think about. Look at your business strategy, look at your business plan, look at how people feel. They may not want to use these fitting rooms anymore. You will need to increase the cleaning in these areas, and you will need a procedure to manage clothes that have been tried on. The current guidance says you should quarantine the clothing for a minimum of 72 hours before it returns back to the shop floor. Think about how that manages your stock levels. How do people manage that? So you'll need a returns bin so that once somebody tried it on, if they don't want it, it can go in there and it can go back and be quarantined and before it goes back onto the shop floor. This also comes back to anything which is being returned. Again, the guidance says a minimum of 72 hours or some sort of sanitization process. Most of the people, it's going to be that minimum of 72 hours for returns. As I say, reduce contact of customers and staff during fitting, and this will come down to, depending on what you're doing, you may have staff supporting fitting. You may have to look at whether that continues to take place, or whether there's a hybrid model, or what you can do to put that in place. As I say, I know for a lot of people that might be one of the main selling points that you've got. So you may have to look at your business plan. You may have to look at going forward. What does this actually mean, and how do I negate this period of time? It will come back, I'm sure it will, but when is the question. And as I say, reduce handling of merchandise. Looking at contractor visits, deliveries and restocking. Now, this is another area where for deliveries and things like that, where there's going to be interaction. So what do we need to do? Well, first of all, reduce contact in deliveries if possible, and reduce that down to one person. So does everybody, all your staff, need to help unload that delivery? Or can you just have, again, that one person who's dealing with stock to help unload? So if you can have a single worker help unload and reduce the contact of the driver, again, it's much improved in terms of that, reducing that risk down. Does everybody need access to the delivery areas, including the delivery person themselves, or can that be left? Can the delivery be left in a secure area? Again, I've put in radios, phones to contact people. If you do not, does everybody need to run around the store waiting for somebody to sign a piece of paper? And look at ways you can maintain that with maybe electronic signatures, electronic stock codes, electronic stock check-in, etc., etc. Try and plan these delivery times in to reduce the contact. So does it have to be delivered when the shop is open, or can it be first thing in the morning when there's less people there, when there's no customers there? Again, this could increase efficiency, and this is going to be for everybody, because even the delivery firms are going to say, we want to reduce our interaction with people, so we're more likely to be happy to deliver out of hours, first thing or last thing, when there's less people around. Always allow and encourage contractors to access the hand washing facilities, because that will, again, reduce the spread. We all know about hand washing. Hand washing has been in the news for weeks and weeks now. So again, allow contractors to access that. And you might have a separate area or separate sanitization area that you ask when anybody comes to deliver something, before you enter, please can you just wash your hands before you come in, etc., etc. This also comes into things like cleaning. When does cleaning take place? Like I said, allow self-cleaning, and that goes for customers, and that also goes for staff. If you can allow self-cleaning of things like trolleys, baskets, bags, hands, anything like that, allow the self-cleaning the best you can, but you will also need to increase your cleaning. Like Andy said, if your shop has been closed for a period of time, you will want to do a deep clean before people come back in. And this is good practice, ignoring COVID. If an area has been closed for a long period of time, you're going to want to clean it before you use it. But again, this also helps in terms of the confidence of people. So I would personally document that. Share it on your social media, what you're doing, to show people that you have sanitized the area, and they'll feel more confident again going forward. You will have to look at your existing risk assessments. The one I've put on here is air conditioning. Air conditioning, they have said, providing it was safe beforehand, it should be safe now. This may mean you need to get it serviced because it's been switched off for a long period of time. You need to look at things like your Legionnaires assessment and whether that has implications, especially if the premises has not been open for a long period of time. Have a look at your your risk assessments that you've already done on that one. Increase your cleaning. At very minimum, increase it, and I'd make that fairly visual. I know I've said do that out of hours, and I agree, and I still say do it out of hours because we're reducing that contact, but make it visual, as in advertise your additional cleaning. Like I said, put those signs up to say when it was last cleaned. That is a very visual way of showing additional cleaning without the additional cleaning taking place in front of somebody, which would increase contact. So you're still doing it out of hours, but you're showing exactly what you're doing. And there is no problem, I think, in advertising that on social media. It sounds a bit of a strange thing to advertise of what cleaning you're doing, but that's what people want these days. They want to feel confident. High touch areas, trolleys, checkouts, things like that may need cleaning regularly. You may need that ability to clean between use. So I'm going to say things like card payment machines, the keypads. You may need to put a pack of wipes or something like that on each checkout, so it can be wiped after use, so that people feel confident, as well as reducing down the transmission. And as I say, sanitization zones. The other thing I put here is about personal items. If we can keep areas uncluttered, if we can keep areas simple, they are much easier to clean. There's also less items, less things that can hold the virus. So clear desk policies in terms of anywhere within the business, I think is extremely important here. So you may want to put lockers in for people to store their personal items, so you haven't got a back room which is got full of bags and stuff like that, because it does make it a lot more difficult to clean those areas. And it also keeps those nice and tidy, keeps your other health and safety risk assessments fairly tidy, and allows your ability to clean those areas and keep things safe and secure. Do make sure you communicate the measures to all. Nobody, no staff member has to attend an unsafe work environment. And as I said to you, you will probably be safe. You will probably put things in place, especially as you're attending today's session. So you've obviously got a process you're looking at putting in place. And if staff say they do not feel safe to come back, it's usually down to communication. And you'll have the same issue when you're looking at clients as well. So communicate it. How do we communicate it? Well, the first one I'm going to say here is share your risk assessments. Put them up on your website. The advice actually is businesses over 50 employees should put their risk assessments on their website. That is what they say. I'm actually going to say that should be for everybody, I think. I think that's a good practice to do because it shows you've done it. Now, you might tidy it up and make it a little bit more pictorial, a bit like some of the pictures we see about washing hands and stuff like that. That's still put it up on your website, but communicate it, share what you need to do. If people don't know what your risk assessment says, then they're not going to be able to adhere to it. Use signs, remind people at all points, and try and do it in a way that's fun. That's, you know, try and do it in a way that's not, you must do this, you must do that. So try and put those signs out. Try and put those signs on the floor. Keep 2 meters, wash your hands, all those sort of things. Put them out. The more you can out, and there are some great downloads. If you look at the HSE website, but there's some good downloads. But things like the washing hands ones, Public Health England have some downloads where you can download those posters and print them out, so they don't have to cost a fortune. And I've got some links at the end of today's session for people for downloading some of those. And as I say, Arco have got some on their website. I was looking last night. Download them, print them out, laminate them. Don't need to cost a fortune. As I say, it is advertising. It needs to be part of your advertising schedule. So you need to think about not just advertising your product, not just advertising what you do, but advertising how you are managing this situation. Now, advertising and communication is really important at this stage. And as I say, look at your existing risk assessments, because changes that you'll be putting in place, and these are going to be fairly major changes, will have impacts on your current risk assessments. So the main ones I'm going to say look at. The first one is your fire risk assessment. You will need to review that, especially if you're looking at opening doors. If you're looking at changing to one-way systems, if you're looking at changing your store around, that will change your fire risk assessment. It will change how people enter and exit in an emergency. So you will have to review that. It may not mean you have to make any significant changes, and it may mean that you're allowed to open more doors than you thought, etc., but you will have to review it. Again, Legionnaires is one, and I spoke about it from air conditioning systems, but also think about hot water and cold water systems. And this might be a very simple thing about first person in after it's been closed down for a while, because the water's been sitting in the pipes, run the taps for a bit. At a very minimum, I think that should be something you're going to have to do. But it's those sort of little bits, little things that you need to do. Chances are your Legionnaires assessment isn't going to change. But what it will do is tell you what you need to do to reopen your shop. If you've got people working from home, so you've suddenly gone, well, okay, the bookkeeper doesn't need to come in, they're going to be working from home, etc., well, you might have to look at your lone working and working from home policies, because they've not been in place before. As I say, mental health is something which is extremely important at this time. Change is something which affects mental health. Change is something you need to take into account. You need to take into account yourself, your employees, and I'm going to say customers to a point, and make them feel that they are still part of this. So I'm going to say regular meetings, those toolbox talks, coffee mornings, anything like that. Listen to what they have to say. Unknown is the biggest problem for mental health. Unknown is the biggest thing that stops people from doing things. And I'm afraid this comes back to that communication. And I know I keep harping on about communication, but it's more important than anything you're doing in terms of putting things in place. Your communication of what you're doing, so that people feel safe, so that people know what to do, is the most important part of any of this. Because we are in a changing environment. Things have changed. We've had the biggest change in the last few months than we have in the last certainly 5 years that I can think of. People have changed what they do. So you may need to look at other ways you can continue to trade. People's buying habits have changed. Social media has gone up anything from 20 to 40%, depending on what you read. Online purchases have gone through the roof. Ocado, Tesco's, Asda home deliveries are through the roof. And even my little toy shop in the local town is doing home delivery now. So you need to think about, what does that mean? I, for one, I've gone from using big supermarkets to the local butchers, the local veg shop, etc. Do I want to continue to do that? Yes, because I much prefer it. But before, they weren't offering that service. They've suddenly started offering that service. They've suddenly got their apps, which means I can order easily. They've suddenly made it so that they found a new lot of clients. Will they change? I don't know. I hope they don't. But if they do change, I'll probably go and try and find another butcher's, another veg shop, which haven't gone back to their original ways. Because my ways have changed. My views have changed. I hope I'm going to be doing a lot more of these workshops online, because I'll finish this workshop and I'll go downstairs and have a sandwich and come on and do another workshop this afternoon. That means it's a lot more efficient. I'm not traveling as much. I'm not spending so much time in the car. I've got more time with my family. So you've got to think about this changing environment. People have got much more use to the environment. People have got use to the technology. And you're going to need to start looking at how you're going to implement that. Even my parents, who are sort of late 70s now, and I'm going to say very much Luddites before, are ordering via apps, home delivery, etc., etc. They want to continue. They said, isn't this good? So think about that one and communicate how these changes are going to affect your customers and how they're going to affect the staff. So you need to review your business plan. You need to review the way forward. You need to review what people think. Things have changed. Now, I have got a little video I want to play. This only popped up on the other day on BBC. Now, I think the sound on this one, I'm afraid, doesn't work through this program. So I apologize about this. I think it's got, it should have subtitles for you. But this kind of just goes through a little bit about the change of environment. And it's the days of the queue for fish and chips have gone, if you want to look at it on BBC. But I'm hoping this might work. Let's just, if you give me a second. I just need to. Right. Wonders of technology, I'm afraid. Hopefully.
The government came out and told us that we weren't allowed to offer open account service. We changed our business model in about 2 weeks. We wouldn't have been able to have lost that kind of revenue from any more than 6 months. Closure of your business, you suddenly make very fast decisions and you realise that it's actually okay to go out and try things, great business models. That lockdown has made us make changes that benefit our business and make the economy richer. Customers will increase, in trade will reduce, and maybe the days of actually waiting in a fish and chip shop for 15 minutes in a queue.
As you can see there, as I say, a very quick video there just to show that it's not all doom and gloom. Changing things is not necessarily always a bad thing. And you have a look at sort of things you can put in place. That video I thought was really good because it did show screens up. It did show a change of a shop layout, but it also showed it in a way that it wasn't particularly oppressive. It didn't look too bad to me. I'd be quite happy walking into that place. I'd feel confident walking into that place, and it didn't change the experience. And like I said, they found a whole new avenue, a whole new lot of customers, a whole new way of selling, and an easier way of selling. So I'm now sort of coming to the end of the main points of I wanted to go through. I'd say there's a few further information bits there. As I say, the ARCO website on the bottom there, hse.gov. But the main stuff I'm going to say is have a look at the .gov.uk website. The publication, if you go to .gov.uk/publications, it will show you the COVID-19 paperwork, the COVID-19 check sheets that the government have put in for people helping to return to work. And as I say, have a look at it. There is some really good little tick boxes within that. So it is worth a look at. It is one of the documents I would suggest people do look at. Obviously, the other place I'm going to say is do speak to your local growth hub, humbergrowthhub.org. They have some COVID-19 support there, and they have just general business support, because one of the things you've got to think about here is it is a change in business. It is no different to any other change. It is a major change, but think about that chip shop, think about that video, that they've undergone that change and they've actually seen a benefit from it. So try and make it so that you can get those benefits as well as other people. Think about your processes. So I want to go through any questions that we've got now. So I'm just going to have a look to see if there are any questions. At the moment we've got one question come in about the minimum percentage of alcohol that you should have in your hand sanitizer. I'm going to have to say I'm not sure the answer to that one. It's something I would have to look up. But if you want to contact us afterwards, I'm more than that. I'll try and find out for you and have a look, see whether I can find out exactly what that percentage is. So do get in contact afterwards. One of the things is that if anybody does want to get in contact, I'm more than happy to answer questions after this. If you do want one-to-one support, it is available through the humbergrowthhub.org. So do contact them. Has anybody got any other questions about any aspects, anything that they've got in terms of how would I do this, or what about this, or anything in terms of anything there? No. One point actually, I just want to make, just kind of moving on from what was talking about PPE. PPE is always a last resort. And another question that I get asked a lot is, do I need to make my staff wear face masks and stuff like that? Current advice is no. As I say, advice changes over time, so do keep abreast of it. Current advice is no, you don't. But you do need to think about how your staff feel. And if staff want to wear face coverings, I would say you need to allow them to do that however they feel fit. And like was said, you know, do sort of make sure, I'd say they're tidy, and if that's the case, if people want to wear them, I would try and get hold of some decent quality ones for almost staff uniform as such, optional staff uniform. In terms of the hospitality industry, one of the things I'll say at the moment, with the opening of that in July, I think there's going to be a lot of changes in terms of what's going to be required in terms of that. A lot of the hospitality industry, they are still saying the 2 meters. It's still saying the same sort of things. But we do hope we'll have further information as it comes out in terms of hospitality industry, nightclubs, pubs, etc. Whether they'll reduce the to the 1 meter rule by then, I don't know. I say there's lots of different things going to be coming in place. I think there will be further changes. They haven't released too much in terms of their documentation currently. In terms of advisable to serve tea and coffee to customers, I would probably say in most aspects it's something I would probably avoid. If you are going to be doing it, I certainly wouldn't be doing it in sort of shared cups or anything like that. You'd be looking at the sort of takeaway throwaway cups, but I would probably say it is something for the moment to probably put on hold unless it's a real key part of your business, and then you need to look at ways you can implement it. Coffee shops, for example, a lot of coffee shops are still doing takeaways, so there are ways around it, but is it necessary? If it's not necessary, remove it, and you've removed that risk totally. You've removed that risk totally. So yeah, it is a case of removing that risk. What's my opinion on how late night venues will operate in the future? Oh, I will say this is an opinion. It's not set in stone at all. It is purely an opinion. I think first of all, we're going to see a major reduction in numbers of people going to late night venues. I think people's psyche's changed. I think people will not be confident. It'll take a long time for confidence to come back. And I think people have got used to not going out on a Friday night, shall we say, in the same way. I think they will have to reduce the social distancing rules, or relax the social distancing rules, for them to operate in a manner which would be sensible. But I think nightclubs, late night pubs, as we saw them before, will take a long time before they come back to what we used to know them as. I think that's the way it's going to go. How that will affect businesses, I think a lot of businesses will have to evolve to be able to survive it, and will have to offer additional services, I guess, or additional products maybe to be able to cope with that. I could see a lot of late night venues becoming daytime hire venues for maybe meetings and things like that, because one of the things that is going to come from this is a lot of meeting rooms will not be big enough with social distancing. So if your meeting room used to take 20 people, it might now only take 10. So people are going to be looking for bigger venues, and I think that's how I could see some late night venues evolving. So hopefully, as I said, it is just an opinion, that one. It's wait and see. It is wait and see on that one. I really don't know. If there's anybody got any other questions at all? No. As I say, just final thing to say is thanks everybody for attending today. It's been sort of hopefully useful for people. Yeah, I'm trying to make it as useful for people going through really practical things as much as anything else. And thank as well Arco for attending today. What they added, especially with the PPE side of it, is extremely important and an eye-opener for a lot of people, I'm sure, certainly for me. So certainly thank them for today. But thank you very much. If you want any further support, as I say, please do go to the Humber Growth Hub. They'll be able to let you know what's coming up. We've got a few more of these sessions coming up on various topics, including others getting back to work in other aspects from factories, vehicles, which you may find useful. But thank you very much, and look forward to seeing you on some of the other workshops.